Have you ever experienced persistent heartburn or a feeling of fullness in your chest, even after eating a small meal, and wondered what could be causing it? Sometimes these uncomfortable sensations are linked to something more than just typical acid reflux. A hiatal hernia occurs when the upper part of your stomach pushes up through a small opening in your diaphragm, which is the muscle separating your chest and abdomen. Normally, your esophagus passes through this opening, called the hiatus, to connect to your stomach. When part of the stomach slides through this opening into the chest cavity, it is known as a hiatal hernia. The primary reason this happens involves a combination of weakness in the surrounding muscle tissue and increased pressure in the abdomen. The diaphragm's job is to keep your stomach in its proper place below your chest. Over time, or due to certain stresses, the hiatus opening can enlarge or the surrounding muscle can weaken. When the structural integrity is compromised, internal abdominal pressure can force the stomach upward. Think of it like a weak spot in a wall that starts to bulge under pressure from the other side. Several factors can contribute to the development of a hiatal hernia. Age is a significant one, as the diaphragm muscles naturally weaken as we get older. Chronic or sudden increases in abdominal pressure also play a big role. This can result from persistent coughing, frequent heavy lifting, straining during bowel movements, or even intense sneezing. Obesity and pregnancy, which both put continuous pressure on the abdominal cavity, can also increase the risk. Sometimes, a person might even be born with a larger than usual hiatus, making them more predisposed to a hernia. While you cannot directly prevent a hiatal hernia if you have a genetic predisposition, you can take steps to manage or reduce the risk of exacerbating one. Maintaining a healthy weight significantly lowers abdominal pressure. Practicing good posture and lifting heavy objects correctly, using your legs instead of your back, helps too. Avoiding straining during bowel movements by eating a high-fiber diet and staying hydrated is also beneficial. If you already experience symptoms, eating smaller, more frequent meals, and elevating the head of your bed can help reduce reflux symptoms often associated with a hiatal hernia. There are two main types of hiatal hernias. The most common is a sliding hiatal hernia, where the junction of the esophagus and stomach, along with a portion of the stomach, slides in and out of the chest through the hiatus. Less common but potentially more serious is a paraesophageal hernia, where the main portion of the stomach remains in place, but another part of the stomach pushes up alongside the esophagus. Understanding the type can help guide treatment options. Ultimately, a hiatal hernia is a structural issue where part of the stomach moves out of its normal position due to a weakened diaphragm and increased abdominal pressure. While many people have them without symptoms, for those who do, understanding the underlying causes empowers you to adopt lifestyle habits that can greatly alleviate discomfort and improve your digestive well-being, often under the guidance of a healthcare professional.